So, hey guys, so my name is Ryan, and today I'll be actually sharing with you uh, what you need to go through, after doing a wisdom tooth removal, right? Actually, it's a very scary experience. So, in Singapore, it's actually called the National University Centre for Oral Health, right? This is the location. Yeah. So after that, obviously you all have to do scanning for your ID, and then this is actually the location for patients like me lah. So it's actually very aesthetic, and then I'm just waiting for my number over there. Now, for me to get there, I had to walk quite a bit, and then this is actually the doctor who will be advising me for today. So just gonna pause here, right? So if you can see, my teeth is actually pretty bad. Um, so basically, I have to remove my wisdom tooth from the left and right. As you can see, it's sideways compared to everybody else standing upright, right? Those two little bastards. But nonetheless, right? You have to get them removed. So by the time I kind of did this, it's really my second time. So I kind of had a lot of improvements or like know what to do along the way since I already experienced it before. Right. So oh yeah, I forgot to mention that it's actually pretty scary because if let's say they remove it wrongly, um, there's 1% chance that my nerve can be removed or that kind of stuff. So there's something that you don't really have to worry so much, but just on the sidelines, I'm also very worried. Then my hands are like very scared lah. Yeah. So and then the best part of it all, right? Usually we'll have one injections on the arm. You actually have to go five. So it's actually kind of okay until they actually insert this giant needle in, which is not really okay. But I think the best part of it all, you are not able to even see it at all. So it's like something poking through your upper mouth ish, right? Um, yeah, at your gums area. So they actually put like five. They call it local anesthesia, so you don't feel anything. Quite scary. Okay. So obviously, once I'm done with that, I can't even talk in the entire video because um, there's a certain blood in my mouth. So if I talk, right, the blood would, would not be able to heal well, lah, right? It will not be able to clot well. So this would be actually the pharmacy. Of course, when I'm actually pretty happy, I finally get to go through this because if you go through this a second time, it's kind of a bit of trauma because you roughly know what's going to expect and you just want to get it done quickly. So I actually spent an hour just doing this. So not too bad, not too bad. Okay, so these are the broken teeth, alright? Pretty raw. I understand. I know. So this was extracted immediately, and then they had to break, right? If you remember the ones that's not upright kind of tooth, they actually had to drill it in. So during the entire surgery, right, you can actually feel something, drilling in your teeth, right? Something trying tugging in. But the pain is kind of numb, but you can just feel the actions of it. So in the end, the teeth broke into three different parts, and it took I think about half an hour. The first 15 minutes was doing the anesthesia, local anesthesia. The next 15 minutes to get the local anesthesia done. The next 30 minutes is to get the most difficult tooth out. And then the last 5 minutes, the last technically just 30 seconds, right? You can actually just remove the upper wisdom tooth. So it's actually pretty easy to remove, quite scary actually. So if I calculated, right, if I have that number of teeth times 30 seconds, it probably take less than maybe 15 minutes to get all your teeth out. Pretty scary. Yeah, so there's quite a lot of medicine, right? So I think I will just skip to the part other than the teeth, right? You will actually have a syringe to actually help to clean the gum. They call it the gum holes, right? If for any food particles or dirt, food particles, right? Then obviously I actually have something called codeine, which is a paracetamol to actually help to uh, bring down the pain, right? At any given time of the day, right? And I rarely take this actually because I'm not sure whether it's different people have different perceptions of pain, but I'm able to endure it within like I didn't even hesitate this actually the second time round. Like, yeah, I think for me, then I obviously have the swab in case it's continuing to bleed. Uh, you really have to bite it hard, right? Um, then obviously you have your mouthwash, right? You cannot brush the area. I mean, unless you want blood to continue to spill out. Um, then of course you have the discharge advice, right? No vigorous exercises, no hot food or drinks, right? My mouth was actually still pretty numb then, and then of course yeah, avoid solid food. But I'll be honest with you, I took solid food. Later you get to see the video. Mm, I'm not sure. I actually took solid food within the second day actually. Yeah. So if bleeding occurs, yeah, then you continue adding the gauze. Then I kind of and of course if you have severe bleeding, you have to go to the emergency department. And yeah, if you have rash, please see a doctor immediately, right? And then yeah, so I didn't actually had to do any appointments afterwards because doctor said once it's healed, voila, I don't need to come back. So let me see what happens after this. Yes, then of course the map. So this is me trying to rinse off the um, blood off the tooth. Pretty disgusting. So you see the red color. I think it's called like the tooth root, I guess, like the nerve root. So it's actually linked to all your nerves. So it's kind of gross to actually see it. If you touch it, right, it's pretty sticky. Yeah. So yeah, it's all broken. It got broken except for the hole to the birth. Then of course, obviously you want to dry it. So it's about 5 hours after. Now it's about, if you can see from my clock. So let me show you the progress so far. I napped, and then this is blood. Okay, so I had blood everywhere when I woke up. I had like I used like half the entire tissues there just to control the saliva, not to let it drool to my blood area. So when I'm sleeping, I had to put like 5 sheets of tissue, right? And kind of worked actually. So the blood actually clot itself without saliva. Because if you have saliva and blood merging in, not only can taste the blood, not only the blood cannot clot, you still have to go through this process another day or two, which happened on my first try, which isn't something that you want. More tissue paper, my girlfriend, and that one is not her blood. If you guys get the joke. So if the reaction over there, right? She thought it was so late. So hey guys, so taste, got the blood flowing everywhere. Yeah, so as I mentioned earlier, right, there's a metallic taste, right, that will be lingering because you cannot you cannot spit out the blood, if not you cannot clot. Either can you yeah, so the only way you have to do it is to swallow it. And it's kind of gross. And can you imagine you have not brushed your teeth and that entire blood smell is in your mouth? Well, I guess if you want to be a vampire, yeah, for a day or two. I'm trying to get my blood to harden or kind of move my jaw. If not, yeah, so even within a day, right, you should avoid moving like the jaw like open wide. I don't even have to open wide because the stitches they're trying to heal, patch back, the gum. And then I'm not really sure why I actually improved on the second time when I did my wisdom tooth. Could it be because of the doctor that's able to stitch better? I'm not sure. Right? Or is it maybe because I'm more confident in what I'm doing? If you realize, right, my blood actually just nice I was wearing like my menstruation pants. Oh. Then let's see her reaction. First one, the first. Okay, so hope you guys enjoyed the joke. This is actually the gauze, right, that's actually stuck in my mouth. This is the second time I took out my gauze, so it isn't that bloody. The first one, I'm afraid I didn't actually manage to capture it down. It's actually pretty gross. Alright, so yeah, it's like a piece of gum. Oh. So as you can see, I'm only eating porridge, and I can eat all the good. So this is actually like the sad part about having wisdom tooth. You only can swallow food. You can't even chew because you have the gauze in your mouth, and if you want to bite it, right, you just can't, because if you bite it, your tooth will be in pain, right? So the only thing I'm able to eat the food is to smash the fish, or use my tongue and somehow manage to, or you just swallow it whole, if you know what I'm talking about. But other than that, yeah, so they tempted me with chicken, but thankfully there's at least something I can eat lah. Fish at least, right? So for the first day, I don't really recommend you to eat any solid foods. You don't want the blood to come out. And then most importantly, right, I suggest you to kinda sleep, like the moment you're done with the surgery, right? The moment you're done with the surgery, take the medicine and literally just sleep, because if you're awake the whole time, your saliva would kind of grow everywhere. And it's kind of disgusting. So let's see what happens here.
Guys, so it's 8:06. I just woke up. Alright, and I'm gonna go brush teeth.
First of all, it's not 6, it's 8, but never mind.
My healing has stopped. Yay! And then
So at the time I'm recording this, right, this is about 10 hours ago.
yeah, let me show you what I'll do. Okay, so since the wound is kind of healed, I'm gonna go and brush.
So this is not recommended for everybody. Alright, if you feel comfortable that your jaw can move a little bit, go ahead and brush, go ahead, right? Yeah, I mean, obviously avoid the part that your wisdom tooth has just been removed at, right? Remove probably the other side, right, as much as possible to really clean. Otherwise, if there's an infection, you kind of have to deal with both sides, and that will be quite a feast bad moment.
Right, but onto the left side or the right side. Yeah.
Okay, yep. So this is basically me talking about it, and me brushing my teeth. I mean, who haven't seen people brushing teeth before? Oh, and then this is actually the mouthwash, so it kind of replaces the toothpaste. Yeah.
I'm gonna be taking.
Okay, so what is itorixoxib? As mentioned again earlier, this is actually a stronger painkiller than the paracetamol one. So this, I would recommend everybody to take it, right? At least for the first, at least minimally at least like 2-3 days in the morning. If not, it'll hurt like a bitch. Seriously. Yeah, so
Advice on.
oh, forgot to mention. As you're swallowing the pill, right, with water, try to avoid this part as much as you can. If not, blood and clot, and you're back at square one, guys. You're back at square one.
Just for me, not sure how about you.
Yeah, so as I mentioned again, codeine, if you really do not feel pain, don't take it, because in future when you really need it, it will work. Right? No point taking it and you kind of kill yourself for it. Yeah, and you take even stronger painkillers, and eventually your kidneys would. Yeah. Okay, anyway, so.
Right.
So for me, right, I only had to take like 2 tablets like in my entire duration, and this is actually for just uh 2 wisdom tooth removed. I had 4. I only took 2 tablets for the first one. So this is maybe with this chips, I think you don't have to endure so much pain. Or they hope to reduce it. So I kind of had a bit of as you can see, right, I kind of had a bit of solid kind of food like century egg, or like maybe a little bit of fish, right, to bite on. So I already removed my gauze because it already stopped bleeding, and of course some of the soybean there. Yeah, so with that, I think I've come to the end. If you have any questions, please leave it below. If you have any, I hope you guys actually enjoyed the advice, and please take care. All right, see you guys next video. Bye.